Tripod of life. If in any leg of a tripod, a stool with three legs is broken, the tripod falls down. In a similar way, the brain, heart, lungs are considered three very important vital organs in the body. If any of these organs stop functioning, all other system also stop functioning in death occurs. So these three organs, heart, brain, and lungs, are considered as three legs of life, that is tripod of life. According to the Bichat, the following three vital organs constitute the tripod of life: brain, consciousness, circulation, heart, lungs, breathing, respiration. These three systems, brain, heart, lungs, are also known as atria mortis. Atria mortis is a gateway of death or a death's portal of entry. The next is a loss of a tripod of life. Permanent cessation of function of brain. In the past, a person who respiration and circulation has ceased for a period of at least 10 minutes was considered as to be dead. Even today, for practical purposes and also in clinical practice, the permanent cessation of respiration and circulation are considered sufficient to assume death. However, in the present scenario, due to development of newer technique, for example, cardio-prosthetic measures, it is now possible to maintain by artificial means the life of a patient whose respiration and circulation have ceased permanently. Also, the two criteria, cessation of respiration and circulation, cannot be applied to every case. So diagnosis of death in the present scenario has become more difficult. As a new concept, the concept of brain death has come out. Permanent cessation of the functions of the lung. Permanent cessation. The permanent cessation of breathing or respiration. Respiration or breathing can be detected by careful examination of the chest and abdomen for respiratory movements. Auscultation of the chest may also be done for these purposes for 10 minutes. While doing it, would be keep in mind the apneic intervals of the chain stokes breathing, which rarely exceeds 30 seconds. Change when a person is just hours after death, there is a change in breathing. The rate changes from a normal rate and a rhythm to a new pattern of several rapid breaths followed by a period of no breathing. Apnea. Permanent cessation of the function of the heart. Permanent cessation of circulation. The best and most reliable method to detect the circulation is auscultation of the chest. If no heart sounds are heard for a period of at least 10 minutes, it indicates permanent cessation of the circulation, although the heart sounds may be masked in some condition, for example, pericardial effusion. For example, pericardial effusion, empyema, obesity. Palpation of a peripheral pulse is not considered as a good criteria to detect the cessation of circulation because heart may continue to beat without a perceptible peripheral pulsation. In case of drowning or electric shock, the patient may remain in the state of a suspended animation, wherein a peripheral pulse may not be detected for so long as half an hour. For example, a patient suddenly loses his consciousness. His heart stops working, the flat ECG, and lungs also stop working, no breathing. It is equivalent to the loss of the tripod of life. As per the old concept, that is tripod of life, this person should be considered dead. But actually, we don't know whether the loss of these three functions is reversible or irreversible. Suppose we perform CPR, cardiopulmonary resuscitation, and a person revives, we can say that the functions of all these organs stopped, but all these organs stopped working, but reversibly. Suppose after CPR the patient does not revive, it means that the functions of all these or three organs stopped working, but reversibly. The later case is suggested somatic death, that is complete and irreversible cessation of stoppage of the brain function, circulation, and respiration. Medico-legal aspect is tripod of life was a criteria for death in the past, so is now obsolete. Now history interest. If these three organs stop functioning, it doesn't mean that the person is dead. Before a person is declared death, it should be confirmed whether this organ stopped working reversibly or irreversibly. It may be possible only after performing CPR. All these vital organs may start functioning and again, and the person start living his life. Thank you.